Member for Saanich North and Islands.
Thank you, Mr. Speaker. And if we were to be taking the Premier's defense on this, then members of this side of the House should never be on members on that side of the House, and members on that side of the House should never be on this side of the House. Because what I'm about to point out is what one of the Premier's members said. Well, they were on this side of the House. An article published in the Vancouver Sun on August the 3rd, 2018, highlighted TELUS's $100 million purchase of Medicis. Quote, the acquisition involves about 30 boutique clinics which operate under Medicis, Copeman Healthcare, and Horizon Occupational Health Solution brands. Some of them charge hefty annual membership fees for affluent families and executives. Reflecting on Copeman's business model in his past role as health critic, the Minister of Health, the current Minister of Health, is quoted in a 2007 Tyee article written by Andrew MacLeod saying, quote, people aren't paying for those services and everybody knows it. You're paying for the right to see a doctor, end quote. The Vancouver Sun states, quote, Copeman Healthcare has 4 swanky clinics in BC and Alberta, catering to well-heeled patients, corporate health programs, and business executives, end quote. TELUS purchased Medicis because, quote, it's a profitable entity, end quote. And they have a lot of stake as they've got billions of dollars developing health record software. Mr. Speaker, what I want to know is why this NDP Minister of Health is standing on the sideline while a company like TELUS, with obvious profit motives, are allowed to entrench a 2-tier primary health business model in British Columbia.
Minister of Health.
Thank you very much, Honourable Speaker. And what the member has suggested is that the issue that he's been raising has been around for a long time, which is the provision of non-medically necessary supplementary services. And there's a debate about those services. In 2018, after I became Minister of Health, I think it was 2008, I think was the proper reference, not 2018. But in 2008, after I became Minister of Health, the Cabinet decided, after due consideration, to bring into force an act of the legislature that had been passed under the previous government and never been brought into force over the previous 15 years. That action that was taken by me as Minister of Health and by the Cabinet ensures that the provisions against extra billing have been strengthened in BC. With respect to issues raised last week by the member, the Medical Services Commission did take action and worked to ensure that a provider was brought into compliance. If the member believes that TELUS Health is not in compliance of the Medicare Protection Act, he should bring that information forward. But for my part, we've brought into force a new law. We've brought into force repeated actions that support public health care and limit private intervention in public health care, repeatedly done so. And in this case, we're asking the Medical Services Commission to review all these issues to make sure that everybody is in compliance. I think that's the right approach. That's the approach that protects public health care, and that's what I'll continue to do.
Member for Saanich North and Island, supplemental.
At the heart of this, Mr. Speaker, is the reality that a primary feature of the tech industry, of course, is the disruption of business models. It can happen very quickly, and jurisdictions that do not have the proper regulatory framework in place are vulnerable. Josh Blair, head of TELUS Health, said at the time in that Vancouver Sun article, quote, when you look south of the border, you see American tech giants moving into this space. So together with TELUS and Medicis, our intention is to create a Canadian health tech champion that can be an alternate to the American tech giants, end quote. In the Vancouver Sun article, Dr. Brian Day, co-owner of the Canby Surgery Centre, an advocate for private clinics, pointed to the entrance of Amazon, Berkshire Hathaway, and JP Morgan Chase into the American health sector and said, quote, I expect to see a positive and much-needed disruptive innovation, end quote. The Minister of Health should not be brushing this off. He spoke to the clear and present danger to our universal, equitable primary health care system in the past. My question is this, do corporations like TELUS have a place in the NDP's vision for primary health care delivery in our province?
Minister of Health.
Well, Honourable Speaker, TELUS has the same obligation as everyone else, which is to support and to follow the law, which is the Medicare Protection Act. The idea that the member is singling out what is a BC-based company as the sole target of this criticism, I think, is incorrect. What we need to protect public health care is investment in public health care, is enforcing the laws around public health care, in bringing back workers who are wrongly privatized into the public system. But it seems to me what we also need is to improve what public health care does for people. And that's why in BC we have 12 MRI machines operating 24/7 in the public system. Why we've increased the number of MRIs, for example, an area where private health was strong by 47% to improve services for people. Why we've added 54 primary care networks, 26 urgent and primary care centers. Why we've added surgeries to reduce wait times. Why even during a pandemic there are fewer people waiting for surgeries than before. We don't just need to defend public health care, we need to improve it, and that's exactly what this government intends to do.